Or you might feel like no matter how hard you work out and eat right, sometimes you just can't get rid of what you might consider problem spots. 2 new trends in fat reduction aim to change that, and Rena Sargentopoulos is here to tell us all about them. Hi, Rena.
Hi, Julie. You know, there's a couple of new procedures out there that say they can take a bite out of your bulge without actually having to go under the knife, and they're literally going to leave you feeling hot and cold.
This is it. Come into push-up position. Push. Don't quit.
Denise Joyce is a speech-language pathologist and the mother of 2 beautiful girls.
And down and lift.
She's been shredding it with Jillian every day, but just can't seem to target her trouble spots.
There are certain pants, you know, you can only wear with certain shirts because otherwise you got the muffin top or you got this little thing back here. Press.
Yep.
Meanwhile, Kinsey Schur and her boyfriend are personal trainers. They exercise and eat well.
We're always trying to get some kind of a lean protein and a vegetable and then some sort of a healthy fat with every meal.
Despite all that, Kinsey hates her hips.
I don't think she was in need of it at all, but she has a different story about that.
2 different women, yet with very similar stories, and likely you can relate to one or the other. Wanting to lose a few inches here or there. Both chose a different path, though, to do it. One hot, the other cold.
What we're looking at is your hydration level.
Denise is doing Vanquish.
This is the spacer.
A relative newcomer on the non-invasive fat removal scene.
How are you feeling? Fine.
Doctors say Vanquish uses radio frequency
It's measuring energy in and measuring energy out.
that targets the fat cells just below the skin surface. It basically burns them up, kills them off, and eventually your body releases them as waste.
It's a little warm, but almost like the feeling of the sun on your skin when you're in the summer, when you're outside.
The technology isn't new, but the procedure is only on the market for about a year now.
If you need to lose 50 pounds, you're not going to see a change on the scale. But if you're really looking to lose that last inch, those are the people we're seeing the result.
I'm just going to give her a little wipe.
Denise wants to lose her love handles and tighten her tummy.
We want to make sure that we're fully penetrating that fat layer.
It's a 30-minute session once a week for 6 weeks. Doctors say it will be an additional 6 weeks after that before the final results are realized. Those 6 sessions will cost $2,000. These are some before and after pictures given to us by Health Partners cosmetic and plastic surgeons. And here's the skinny on Vanquish. It is FDA approved, but only for deep tissue warming, which helps with muscle pain.
It's a treatment process.
Dr. Heinrich, though, believes approval for fat removal is just around the corner. Side effects include hard knots that can soften over time with massage and possible blistering. And maybe you just can't take the heat.
Cold.
Let's catch up with Kinsey, who's doing something called Coolsculpting.
We'll get you nice and comfortable.
This time, we're freezing the fat cells.
Oh.
You can freeze a fat cell at a degree that no other cell in the body will be hurt.
Just like with the heat, doctors say you flush the dead fat cells out with your waste.
So you'll feel a little bit of a pulling sensation.
And here's how it works. The machines suck in your flab like a vacuum.
Initially it was really uncomfortable, but now it's going away. It's not a big deal now.
Kinsey is having her hips done, so she'll need 4 one-hour sessions.
Okay.
So 2 hours on each side. The cost, $2,250. Some doctors do those sessions 30 to 90 days apart. Dr. Harrington stacks hers, so you're done with the whole process in one visit.
With the way that I do my treatment, you lose about 40 to 60% of your fat cells in that area. So if and when you gain weight, hopefully not, but if you do, there still are fat cells there, so hopefully you'll just gain it more proportionately.
That means how much the vacuum's pulling in.
Coolsculpting has been FDA approved for fat removal since 2010, but just in the hips and abdomen. These before and after photos show those results and results from other areas treated, like arms and back fat. And these pictures are of Dr. Harrington herself. She wanted to try the procedure first before trying it on one of her patients.
Comfortable?
Yep. Side effects can include numbness, itching, and swelling for a couple of weeks, and some patients can experience pain and bruising.
That's it?
That is it.
That's it. The long and short, or should we say hot and cold of it. But both doctors warn, neither procedure is a magic pill. Yep, you're still gonna need to eat right and exercise, like it or not.
Beautifully done. Perfect.
Well, we did follow 2 women on this journey. These procedures do work for men too, and both practices have treated men. And if you're wondering if these procedures are permanent, the answer is the same for both. You will permanently have fewer fat cells in the area that you have treated, but you're still going to have fat cells, which means you can still get fat. The idea, though, is that less fat will come back to that treated area, and we do have more information for you at care11.com.
You know I have to ask, because everyone's going to be emailing and hitting us up on Twitter. Kinsey, really?
I know. You and I would look at her, and I know everybody else out there is looking at her too, saying this young woman did not need to have anything done. But we all know about how we feel about our own bodies, and when you have a problem and something that you don't like, you want to get it fixed. And Kinsey's the perfect candidate for this because she really only has about an inch to lose anywhere. So it's helping her better than anyone else.
Thank you, Rena. Randy.